Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello again. Always a pleasure to see you.
Thank you, doctor. I'm feeling a bit anxious, though.
I understand. Having gone through your recent tests and reports, it suggests that you might benefit from an angioplasty. It's a way to open up the narrowed blood vessels and improve blood flow to your heart. How does that sound?
I've heard of it, but not in detail. Could you walk me through the procedure?
Of course. Firstly, on the day of the procedure, you'll come to our cardiovascular suite. We'll ensure you're comfortable and administer a sedative so you're relaxed but awake. We'll numb a small area, typically in your wrist or groin, where a catheter will be inserted. Through this catheter, a tiny balloon will be threaded to the site of the blockage. Once there, the balloon is inflated to push the plaque against the artery walls, opening up the blood vessel and restoring flow. In many cases, we'll also place a stent, which acts as a scaffold to keep the artery open.
Sounds a bit overwhelming. Is it safe?
It's a common and safe procedure. There are risks associated with any medical procedure, but we have an experienced team and use advanced technology to minimize those risks.
How long will I need to stay in the hospital afterward?
Usually, patients stay overnight for monitoring. If everything is stable, you can head home the next day.
And what about my activities once I'm home? Any restrictions?
Initially, you'll want to take it easy. No heavy lifting or strenuous activities for a few days. Gradually, you can resume your normal activities under our guidance.
Will I need to take any medications afterward?
Yes. To help keep the artery open, you'll likely be on blood thinners for a period of time, and we'll discuss that in detail.
My friend mentioned something about a cardiac rehab program. Is that necessary?
Cardiac rehab can be beneficial for many patients after angioplasty. It provides structured exercise, education, and support, helping you return to a healthy lifestyle.
That sounds promising. One last thing. I love dancing. Can I continue with it?
Absolutely. Dancing is a great form of exercise. Once you're fully recovered and with the green light from us, you can definitely dance your heart out.
That's reassuring. Thank you, doctor. I trust you and the team. Let's move forward with the procedure.
Great decision. We'll ensure you're taken care of throughout the process.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon.
Hello, are you Dr. Stevens?
Yes, that's me. And you are Mrs. O'Connor?
Yes, that's right. It's good to meet you.
What can I help you with today?
I've been experiencing a lot of lower back pain lately.
I'm sorry to hear that. How long has this been going on?
About a month now. It started gradually, but has gotten much worse in the last week.
Were there any incidents or activities that you believe might have caused it?
I recently started doing more gardening, and I guess I might have lifted something too heavy.
That can certainly contribute. Do you feel pain radiating to your legs or any numbness?
A bit, yes, mainly to my right leg. Sometimes there's a tingling sensation too.
Got it. Any other symptoms or conditions you think I should know about?
Well, I've had some occasional headaches, but I'm not sure if they're related.
It might be. We'll look into it. Do you currently take any medications or have a history of back problems?
No medications, but my mother had some disc issues in her back.
Genetics can sometimes play a part. I suggest we get an X-ray and possibly an MRI to understand the root cause. In the meantime, I'd advise against heavy lifting.
That sounds sensible. Should I also stop gardening for the time being?
It would be a good idea, at least until we pinpoint the issue. It's better to be cautious.
All right. Anything else I can do for relief?
I'll prescribe a mild pain reliever and also recommend some physiotherapy exercises. It will be beneficial if you can see a physiotherapist.
Sounds good. And how about sitting for long periods? I have a desk job.
Try to take short breaks every hour. Walk around for a bit. Prolonged sitting can exacerbate the pain.
Thank you, Dr. Stevens. I appreciate your advice.
It's my pleasure. Let's schedule a follow-up after your tests.
Perfect. See you soon.